Welcome to the Dayton Unit NAACP Facebook Live teleconference regarding the coronavirus COVID-19. This is an epidemic that has plagued our nation over the past month and a half or so, and hopefully we will see some kind of relief, over the next month or so. Now, I want to read an impact statement. We're going to have five people that's going to speak to you today. One is myself. I'm going to kind of lead out the discussion. Then we're going to hear from, after I get done speaking, we're going to hear from Felicia Hill, who serves as the Health Committee Chair for the Dayton Unit NAACP. She's a nurse and works inside of the healthcare systems here inside of Montgomery County, Ohio. We're also going to hear from the Health Commissioner, Jeff A. Cooper, to talk about some things that he's working on. Then we're also going to hear our hospital systems. We're going to hear from John Weimer with Kettering Health Network. He's basically over all of the emergency preparedness inside of their network of hospitals. And then lastly, we're going to hear from Dr. Mark Belcastro, to talk about, give us some good information as it relates to what we need to do as Americans, to ensure the safety and well-being of all of the citizens. We as individuals here in Montgomery County, we're concerned about our citizens, and we want you to go back to your respective counties, your respective cities, your respective communities, and do the same thing, and to understand that this is a very serious issue that can lead to a 5-letter word, DEATH, death. And what we are trying to do is do everything in our power to give each one of us extended life, LIFE. So with that, as you see behind me, we're going to have some social distancing as our governor has asked, as 45 has asked. So we're going to do some distancing, and we're going to come up one at a time. They have some questions that they have already prepared, or that we actually, the NAACP, prepared for them, that they're going to answer. And once they answer their respective questions, then we'll go to the next person in line. And then if there are some questions from all of you, our online activists, that you may want to ask of any of the panelists. We have 2 individuals here today that are monitoring the questions, and then we will address those questions as they come in. So with that, if our panelists, can go ahead and take a seat, then we'll go ahead and get started here. So I'm going to kind of talk about at a high level, the NAACP, as we look at the coronavirus in our communities. The coronavirus outbreak is officially a pandemic, according to the World Health Organization, because of the racial and economic inequities. The effects of the virus could be compounded for Black, Brown, Asian, and indigenous communities, as well as other population groups. The NAACP has released a resource to guide officials responsible for addressing health, economic, and other impacts in remedying some of the issues that are disproportionately affecting communities of color. Our policy experts have outlined key considerations and recommendations in containing the spread of the coronavirus. And here is what we came up with as a national organization. We're looking at 10 impacts of the coronavirus COVID-19 outbreak on communities of color. Number 1, racism and stigmatization have increased, particularly towards the Asian and Asian American populations. Number 2, certain populations, including immigrants, incarcerated people, people over 60 years old, people with disabilities, people with special health needs, and others are at an added risk of exposure and other implications. Frontline workers face tough choices between abstaining from work or risking exposure. Census and voting may be jeopardized as public outings continue to dwindle. like here right in Ohio. There's a debate that's going to happen on the floor of our House tomorrow to see exactly when we're going to hold our midterm elections, which should have been on March the 17th of this month. The coronavirus remediation will result in increased exposure to toxic cleaning chemicals. Children and college students risk exposure in schools. If schools close, students may experience food and housing insecurities. There's a lack of accessibility to testing kits. Quarantine policies and practices are unfolding with a risk to human and civil rights. The coronavirus has already been used to justify increased militarization and more restrictive immigration policies and practices. And finally, denial and misinformation on the crisis can worsen the outbreak. So, these are the impacts that the NAACP feel that can happen for people in the various communities of color. So what are some policy recommendations to temper the impact of the coronavirus on communities of color? And we have identified these as an organization. Shift the narrative surrounding the crisis. The virus is the enemy, not the person who is infected. Adopt policies and increase access to child care, health care, and humane sanitary living conditions to at-risk vulnerable populations. Advocate for, adopt policies that increase access to child care, health care, and humane sanitary, I think I already said that already. Number 3, advocate for the establishment of a paid leave system. Strengthen OSHA standards, provision of training and safety gear and routine testing for all workers. Ensure the data collection for the census through online and telephone enumeration extend the voting hours and minimize large gatherings. And I just want to make one point about that. From my understanding, my intelligence is telling me that when the House votes tomorrow, that they're looking at not being able to hold any in-person voting, because of the pandemic. But we believe that if they open up the government in the month of May, because that's the projection at the present time, then they should open up the line so people can have in-person voting for the ones that actually want to have in-person voting. Significantly increase the stringency advocate for equal standards of sanitation, safety and health, as well as education continuity, food assistance for families, and the establishment of housing assistance through the Stafford Act provisions. Number 7, advocate for funding for an effective health infrastructure, prioritization of testing for vulnerable groups and populations, and equitable distribution of limited hospital supplies. Number 8, we want to establish and enforce a quarantine bill of rights. Number 9, establish sanctuary sites, repeal the travel ban, and repeal the restrictions on the provisions of health care to immigrants. And lastly, we want to advance litigation for the willful misleading of the public for political gain, while jeopardizing the well-being of the nation. So those are some recommendations that we are looking at as an organization for communities of color. We thought that it was very, very important, to host this town hall, and we are so forever grateful to have the gentleman and the lady who's going to be giving you some very fine, precise information as healthcare professionals. So at this time, I want to hear from Felicia Hill, who serves as the Health Committee Chair for the Dayton Unit NAACP, and she's also a nurse inside of our healthcare systems here. But one thing before she comes up, make certain to always sanitize. Here's a sanitizer that you can use to wipe your hands, and as she comes up, she'll come in and she'll wipe her hands down and make certain that she's sanitized, and we'll be all good. And then for you at home, and if you want to go out and get you one of these little devices, because one of the factors is your temperature. So you can turn your temperature gauge on, press it against your forehead, and take your temperature. My temperature is 97.6. It's right on point. So with that, Felicia, come on up.
Thank you, Derek. Hi, my name is Felicia Hill. I am the Health Committee Chair of the Dayton NAACP. And some of the questions that were posed to me are that I have. And I thank you for tuning in to this Facebook Live program. And our number one goal is to keep you healthy and to be advocates and to champion the health of all communities. As the question posed here is, as the Health Committee Chair of the Dayton Unit NAACP, what steps are you taking to address the coronavirus or COVID-19? One of the steps for sure is abiding by Governor DeWine's stay home order, making sure washing my hands frequently, keeping them moisturized, along with sneezing in my sleeve. Now, that's something very simplistic that we can do, and I'll demonstrate that a little later. And maintaining cleanliness, making sure that my hands are clean and things that I touch that I wipe off. So those are some of the steps that I am taking to address the coronavirus and COVID-19 and making myself available, because I'm also an ER nurse, which that's one of my passions, and a school nurse. So when the time arises, which it will, to make myself available for the need. The second question, what actions are you personally, and I just answered that, why is it so important to avoid the hospitals if it's not a true emergency? This is so crucial because it utilizes, when you go to the ER and it's not a true emergency, it utilizes resources that are so valuable at this time that that is needed to combat this pandemic of the COVID-19. People don't understand and you also expose yourself to being more susceptible to other infections as well. So if it's not a true ER emergencies, to avoid using unnecessary resources and the resources that are truly needed to help the whole health of our community, avoid going to the ER if it's not a true emergency. Why is it so important? Okay, how do I think Ohio has responded to this crisis? Top notch. Governor DeWine and Montgomery County and also the city of Dayton and other communities have shown true leadership. Sometimes we think maybe it's excessive. However, we will be ever so grateful and thankful because I know lives are being saved by his actions. This is not something to play with. We have never experienced something like this before. So the actions that he has taken with his administration, local, our president, Derek Ford, is going to be instrumental into saving lives. How do you think Dayton and Montgomery County responded to this crisis? With force. Force meaning that the actions that they have taken, making sure the resources are there, or at least combating from my perspective of what I see, but others, experts, will be able to address this a little better. But this is my personal opinion as the committee chair. I think that they have done an excellent job making sure that our community stay healthy, public health, and also the two area hospitals and the networks are making sure that they stay in contact and exercising what I know is right for our community. So those are things that I see that as the NAACP Health Committee Chair. What we also have done is on our website is Dayton Unit NAACP.org. Once again, that's Dayton Unit NAACP.org. We have posted information on how to prevent the number one way of preventing any type of disease or virus transmission, hand washing. That's so simple, but it's so crucial. 20 seconds for 20 seconds at a time. And this is the technique that you should utilize is when you wash your hands, turn on the faucet, wet your hands, lather up with soap, scrub your hands back and forth, not up under the running water, lather them up really good. And a good point, singing your ABCs twice is about 20 seconds, so that's a good gauge. But scrubbing those hands back and forth, and then rinsing your hands off, taking a paper towel, drying them off, making sure that you moisturize your hands as well. So the reason why you want to keep moisture in your hands is because we get little cuts and crevices on our hands and dry out our hands, and that also can cause us some exposure. And dispose of the paper towel correctly. And as I mentioned earlier, I'll demonstrate how to properly sneeze. Something very simple and plain, how to cough. Sneeze in your sleeve. So here we are. Hot chew. it captures all of those secretions that could get elsewhere right in your sleeve. So sneeze in your sleeve, cough in your sleeve. I know oftentimes we'll cough. That's not proper whatsoever because we'll touch something else and also spread the transmission of disease or infection. Thank you for your time. If you have other questions, I will address them after the other two guests are here. But I really appreciate it, and we value the Dayton unit NAACP because they have been a champion not only for civil rights, human rights, healthcare, and I advise you and encourage you to join because it's a valuable committee and community civil rights agency here locally. So thank you for your time, and I'll have the next guest. Derek will be here. Thank you.
Thank you, Chair Lady Hill. You did a fine job in explaining several things that our community needed to know. At this time, we're going to hear from someone that you've been listening to for about the past week or so. So needless to say, this person has been working a lot of hours as our health commissioner. And we certainly appreciate the work that he and his entire staff has done to keep us informed as it relates to this coronavirus COVID-19 outbreak. And so he has a list of questions that he's going to answer. And once again, towards the end, if you have additional questions that maybe we did not capture after we hear from him and then two other guests, then you can ask those questions via Facebook. But please make certain that you pay a very close attention to what our health commissioner, he's basically our top health guy, inside of our county. Just like, the state, you have a top health professional, and nationally, you have a top health professional person. So he is our leading healthcare professional here in Montgomery County. Brother Jeff A. Cooper.
All right, thank you, Derek. Appreciate it, and I'd like to say thank you to the Dayton chapter of the NAACP for the invitation to present this evening. Have a list of questions here that we'd like to walk through and make sure that we communicate effectively information about COVID-19 disease. The first question is a general question. It's, what's your actual role as health commissioner at Public Health Dayton and Montgomery County? So actually, the role of the health commissioner ultimately is to assure that Public Health Dayton and Montgomery County is a high-achieving health department. And we do that by being nationally accredited as a health department. But also it's about reducing the leading causes of preventable disease and premature death, reaching out to underserved populations, and promoting health equity. And so our mission ultimately is to prevent the spread of disease, promote healthy behaviors, and protect the environment. So when we're talking about preventing the spread of disease, that kind of leads into the next question. The next question is, explain the difference between a pandemic and an epidemic. So our health department tracks many diseases, and we develop trend lines over time, over multiple years. And so you could say that we have a baseline established for many diseases, whether it's heart disease or cancer or diabetes or obesity or chronic lung disease or reportable infectious diseases such as hepatitis A, HIV, tuberculosis, etc. When we see an increase for those diseases above the baseline that we've tracked for many, many years, and we know what that baseline is, we would often refer to that then as an outbreak. And then others may call that outbreak, as cases continue, an epidemic. And then once we have sustained transmission and increase in cases throughout the world and in most countries, it's then designated by the World Health Organization as a pandemic. So we start with a baseline that we track over time, identify a few cases above baseline that we call an outbreak. As those cases increase, it's often referred to as an epidemic, and then ultimately where we are right now with coronavirus COVID-19 disease, a pandemic. So the current demographic breakdown, what's the current demographic breakdown of COVID-19 cases in Montgomery County? I think it's important to put it in context of where we are globally. Over 400,000 cases of COVID-19 are occurring globally now. 46,000 or more cases identified in this country. 564 cases in the state of Ohio. And now we have 13 cases confirmed in Montgomery County. 6 males, 6 females. However, we have to understand that all those numbers are an underrepresentation of the true number of cases, or what we would call the actual number of cases. Because many individuals who may be infected with this virus do not show symptoms. We would refer to them as asymptomatic. That's problematic because they can be without symptoms, but they can still shed the virus and infect other individuals. We also know that test kits are in limited supply right now, so we're prioritizing who should be tested for this virus. So we know that some individuals do not have symptoms. We'll never know if they've had the virus. Others, simply there aren't enough people being tested. So we know that the actual number of cases is much greater than the 13 that we're reporting in Montgomery County. So the next question is, what are the most effective methods in avoiding transmission or of stopping the transmission of this virus? So ideally, with a new virus like this, we would have a vaccine, and that would be the most effective means of controlling the spread of this virus. However, we all understand there is no vaccine. The reason I reference that is that we also have another virus that's circulating within our community, and it does so every year, and that's the seasonal flu virus or the influenza vaccine, or the influenza virus. There is a vaccine for influenza, and we strongly encourage, even now, individuals to receive the flu vaccine if you have not. So, number one effective means of stopping the transmission of this type of virus would be a vaccine. We know that's not available right now. So, we also know that we do not have herd immunity, meaning a significant percentage of the population that has previously been exposed and has immunity to where individuals who are infected, if they come into contact with that person has immunity. None of us have immunity to this. It's a new virus. So the top two strategies don't work in this case. No vaccine, no herd immunity, we're all vulnerable. So then we're left, quite frankly, with a common message around prevention, and you heard our previous speakers. We can't stress it enough. Cover your cough and sneeze. Keep these things washed. Wash frequently. If you don't have soap and water, hand sanitizer. And I know it's very difficult to do, but keep these things away from our faces. I can't tell you how many times when we're talking in public and suddenly your face starts to itch. It's inevitable. It happens, but keep our hands away from our face, clean, commonly touched surfaces to where we're keeping the virus contained within the workspace and at home. So we can do that from a prevention standpoint. But also, in terms of limiting the transmission, we've seen the orders established by the Ohio Department of Health and our governor. And a lot of this is focusing on social distancing. And we've all heard the phrasing around flattening the curve. What we want to avoid is a rapid increase in cases to where we overwhelm our hospital system. So we focus on prevention, and then we do social distancing to avoid close contact with each other. And the reason we're doing that social distancing for close contacts is that this virus spreads through, for the most part, respiratory droplets. So you cough or sneeze, we all cough or sneeze directly onto another individual, either into their nasal passage, their mouth, etc., and we transmit that virus. Yes, we can cough and sneeze onto environmental surfaces, and then We can touch that and then touch our mouth and nose and so forth, and the virus transmits that way as well. But the primary mechanism by which this virus transmits is close personal contact among individuals, coughing or sneezing directly onto one another. So those are methods that we have available to us now as tools in public health to prevent the spread of this virus. So the next question is, how are you addressing communities with a high population of immigrants who speak no or limited English? So we obviously understand that not everyone speaks English within our community, and we're doing our best to assure that we're getting information to our non-English speaking population. We have a variety of materials on our website at phdmc.org in various languages. We also have an information line, 937-225-6217, and we have translation services available for that information line. And we would encourage our citizens to use that information line to ask their questions. The next question is, how can we promote compliance amongst individuals that are not abiding by the recent stay-at-home order announced by Ohio Governor Mike DeWine? So it should be very clear to all of us that we're in this together, and that the reason the governor and the director of the Ohio Department of Health have issued these orders is to assure that we protect each other and we remain healthy and safe. Ideally, we would have voluntary compliance, and I think for the most part in Montgomery County, among individuals and businesses, the vast majority will overwhelmingly comply with the governor's orders. However, there will always be exceptions, and public health will use the powers that it has by statute through our Board of Health to order compliance for those entities who are not complying with the governor's orders. The next question is, what should individuals do who are experiencing mental health crisis? Well, clearly this is an unprecedented time for all of us within our community and in the state and nationally. And without question, it can create anxiety and is creating anxiety for many of us. It's a time of uncertainty. It's a new virus. There are concerns. There are not enough test kits. We're not really sure of our hospital bed capacity in the event that we see a rapid peak and significant number of cases. So yes, it creates tremendous concern and anxiety, but that can be managed. And we can manage that by, number one, staying focused as individuals. Focus on what's important in your life: your faith, your family, your job, your neighbors, your friend. That's really important. However, we do not want individuals to turn to substance use or misuse to try to cope with anxiety and or depression or any other mental health related issue associated with this pandemic. So there are resources available at the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board on their website. Adamus also has a Get Help Now app that individuals can download for their smartphone. And it's really about helping each other. So if you see someone in need, help that individual. Obviously maintaining our distance. We're all trying to keep 6-foot distance, but there are resources available within Montgomery County to help those who are dealing with mental health issues associated with this pandemic. The next question is, what processes do you have in place for this vulnerable population? So in a sense, we're all vulnerable because we do not have immunity. However, we know certain individuals are more at risk of serious or critical disease associated with exposure to this virus. So number one, elderly individuals we know are at greater risk. Individuals with pre-existing underlying medical conditions are at greater risk, and we named some of those earlier. So heart disease, any type of cardiovascular disease, cancers of many types. Individuals who are immunocompromised are at greater risk. Also, early on, the data were saying that young adults and children were at much lower risk. So we now know some of the data are starting to show that infants are at greater risk of more serious disease associated with the exposure to this virus, as well as children with underlying medical conditions. But as we heard at one of our press conferences earlier this week, healthy children, for the most part, still remain at lower risk of serious disease associated with the exposure to this virus. So in terms of the processes in place for that vulnerable population, number one, making them aware and making sure that, for the most part, they are complying with the governor's order of staying home, because that avoids contact with other individuals. And it's really about all of us helping each other to the best of our ability to make sure that we all stay healthy. The next question is, please elaborate on the protocol for testing and what steps should you take if you suspect that you've been infected with COVID-19. So first of all, regarding testing, and I don't want to get into all the specifics on the protocol per se, but we understand that there are limited test kits available, and that's going to be the case at least for the immediate future. So what we need to do is prioritize who should be tested. So number one, obviously, if you are sick or feel that you have symptoms associated with COVID-19 disease, talk to your doctor. Ideally, though, the test kits are being reserved for individuals who are hospitalized with symptoms associated with COVID disease, healthcare workers who are symptomatic, because we need to make sure that they can be present to care for the rest of us, and then first responders, fire and EMS and law enforcement individuals who are going to play a critical role in responding to this pandemic. So if you suspect that you've been exposed to someone who has this, or if you begin to develop symptoms, and the symptoms initially are fever, cough, and shortness of breath, talk to your doctor. Your doctor can advise you on the appropriate course of action for you. Keep in mind that most individuals that may contract this disease can often manage their symptoms at home. About 80% of the estimate is that about 80% of individuals that may have COVID-19 disease may be able to manage their symptoms at home. Obviously, you know how healthy you are. You know when your symptoms get to the point for whatever illness. Many people have had the flu before. You know when you're no longer able to care for yourself at home. Talk to your doctor and they will advise you. And then what can non-essential employers do from a corporate giving and or corporate responsibility standpoint? That's a really good question. Montgomery County is setting up a donation center and process for businesses and employers to begin to be able to donate to help our community respond and recover from this pandemic. Just had a sign come up, say your battery is running low. You might need to plug this in. And then finally, what is the message to the community today? We're all in this together. We all have a role to play. We need to focus on prevention. We need to strongly adhere to the governor's orders on stay at home and social distancing.